started on today's session. We have a lot to cover today. Thank you for joining early, ECHO. If you didn't notice, we are recording this session for quality purposes. By participating in the session, you are consenting to being recorded. The recordings will be on our Canvas site after the session. ECHO is an interactive community, so we would love to encourage you to have your cameras on. That makes it easier for our presenter in our getting to know each other, all of that. So please make sure that take a minute and turn your camera on. You will be muted. We are going to have a case narrative today. Case narratives are one of the best ways to solidify information, learn from our coworkers and our colleagues throughout the states. When we are talking and when we are sharing, I just want to make sure that we are avoiding any information that can be identifiable. So don't use real names, family members, where they work, de-identify anything. If you have any questions, please feel free to reach out and we can go over that. Renaming your profile, it does make us, once again, it just build that community of practice. So you can change it a couple of ways, either with the dots next to your name or down at the bottom on your screen with your participant information. Raising your hand, there's also a way to raise your hand and we will get with you on that. If you ever want to pre-register for our sessions, you can email earlyecho@usu.edu. We have a survey that will go at the end of this session, and that's how you will get a certificate of attendance. So don't forget to check that. It typically comes from our red cap. I thought that was the next slide, sorry. So our red cap information, and it might go to your spam or junk mail. It usually gets sent out by the end of the week, so please fill that out. We have our Canvas site. You will get an invite to our Canvas site, and that's where any of the information from previous and past sessions are in there. Case studies. We love to hear case studies. They are one of the best ways to solidify our information. If you have a case that you want to present and get information about, please reach out to us and we would love to hear that. Red Cap is our survey one. We also have a Facebook and an Instagram accounts. So don't forget to follow us. We share information about that, upcoming sessions, as well as any great information that we have. I am really excited today to introduce Mary Beth Bruder. She is a professor at the USED at the University of Connecticut, and she's just bringing a wealth of information over to us. And so I am not going to spend any more time talking, and I'm just going to turn it right over to her. And I'm going to stop sharing.
Okay. Hi, everybody. It's a pleasure to be here. Thank you for inviting me. And it's great to think of Utah because we're in the middle of the remnants of the hurricane, our third in 2 weeks, and our ground is saturated and we're expecting 5 inches of rain, and I've already had water in my basement. So I'm very happy to be distracted talking about something that is very near and dear to my heart, which is how do we support families at any time, families with children with disabilities. I see that a lot of you are practitioners who are on. So what I'm going to share is some data that we collected in the very beginning of COVID in April and May, and we finished data collection of June a year ago, 2020, when we all left like Pompeii. Our offices, we were vacated on that Monday. I think it was St. Patrick's Day, or maybe it was after St. Patrick's Day. We were a day late than everybody else, and everybody just got out of here. And then we opened up. I didn't have to, but we chose to stay for the USED to keep it open. And then a month later, we could bring skeleton staff. And if you walked through our offices, it was like everybody just ran out of here with things just all over. And I'm sure you all had the same experience, which is the raising of our stress levels for the unknown. So we had the opportunity to be able to ask families questions. And I have to tell you that it was not our wonderful, brilliant idea. It was because I'm a part of public health sciences, the academic division or department for which I report. I direct the USED here in Connecticut, and academic public health sciences have a lot of epidemiologists, really smart people, who were very concerned of the misinformation that was out in the public, and really the reactivity of this information and how it was presented. So they put together a very long survey that went out to the public, and then they targeted certain areas or sectors. And we asked if we could do families of children with disabilities. And in hindsight, it was probably way too long because we didn't get some clean information, but it was done to try and find out what were people believing and what were their main concerns. So I'm going to switch to my slides, and my plan is to go through the data, which is not going to be any different from what you've heard from the families you saw. And if it is, I want to hear some of the other things and perceptions, and then open it up for discussion, because I think it really does, it's thought-provoking about what do we do for the next pandemic. We presented for AUCD webinar, I believe it was June of 2020, and we had John Eisenberg, who is the director of the State Directors of Special Education. And he wanted to do his title, now think back then, of let's prepare for the next pandemic. We were still in the middle of reacting to the first. And that has resonated with me, because if you just look at what happened in Louisiana, we are unfortunately, look at the fires out where you guys are. We're unfortunately in a space now where there are lots and lots of emergencies, and we need to be prepared, and we need to be prepared better. So I'm going to share, I'm going to switch over and go into slide mode. It's not there yet because otherwise I lose seeing anybody. So let's do from the beginning. And you guys can see the slide. Is it the funky kind with two next to it, or is it the main slide?
It's the main slide is what I'm seeing.
Perfect. Okay, because I have both. This is from the study, and it is published, and we can get you links if you want to read it, but I'm going to go over all the data. And as I said, it was not a surprising study, but it was data. This is just my background information, and I have no disclosures at this time. And I have two very simple objectives that I'm going to describe to you, a study we did on family needs. And then let's discuss strategies to basically be better prepared and to help families better. The background I already told you was primarily developed because of where I sit, and because I have some really smart people who were doing a whole lot of questions out to the public. And the questions that we chose to ignore, they felt that we were and we still are, in a very political arena, and that people were choosing to ignore public science and pay more attention to politics. So that part of the survey we did not include, but we did include some parts of where do you get your information, who do you trust, and what are the kinds of things you're learning about this terrible virus, to see if people were reactive and not paying attention to what the science was saying, or in fact fairly grounded. So our participants, which was national, we did a snowball effect. We sent it out in Connecticut to parent groups, and then we sent it out to national parent groups. And we had about 1,300 families who submitted their, it was an online survey, their Qualtrics survey to us. But when we went through in terms of clean data, we had a much smaller sample, because people did use this to emote and vent, But in doing so, they did not answer the quantitative data that we really needed to be able to describe who they were. And that was okay because, we were not doing this as our first objective was not scientific. Our first objective was information gathering. So we got a lot of information. What I'm going to present right now is the quantitative data, the clean data set that we had. So the survey itself, as I said, I'm not going to go through it because in hindsight, we should have done it shorter and more targeted. But as I said, we were modeling it after in the existing survey that was going out. In terms of participants, first, I will apologize to these slides. I tried all different ways because I love your background to make this pop. And it's not going to pop as much for those of you who can't see it in front of you. I will read the more important thing. And the first thing you're going to see from our participants, it was very, very skewed, meaning we had mostly females and we had high income, high educated. This was a self-select survey without a doubt. We know there were lots of issues in that you had to read. You had to have a readability index that's probably higher. Well, it was higher than the third grade we like to use. So we knew it was a very small sampling. It is not representative of all families. We want to make sure everybody knows that. It is only representative of the families who chose to answer these questions. So as you can see, the majority were families. What's bolded is kind of like what jumps out. So the majority were female. And then when we looked at their ethnicity and race, et cetera, white. So a very high majority. So this was your white group of females, moms. And again, I think what's not surprising is moms usually have the caregiving burden. So I think anything that would be, we said we want to hear your experiences as parents of children with disabilities. I think a mom would gravitate towards that, not necessarily for any other reason than the mom usually is managing the schooling as a generalization, not certainly as a data point, but just that we weren't surprised with this. The next piece is they were what we would consider two-parent families living with a partner. So again, this is not the families who we worry most about. These were families who at least could get out. They were intact families, mom and dad, or two same sex. But we had two parents in a partnership somehow who were parenting. And as I mentioned, their education was fairly high, 28%, 22%. So if you look at that data, it's almost half already have more than a 4-year degree. Again, these are not the parents who I mostly worry about when I'm doing direct service or doing anything else, but this is who answered. So, and then if you add the 7.9 or the 8% on top of that, you've got your 50%, the 8% of professional degrees. So 50% definitely are higher education than your typical population in the country. In regard to employment also, at the beginning, a little less than 50% were employed full-time. That was one surprise to us, again, when we looked at the data from the fact that we had high education folks. So we don't know. This is, as I said, every good study gives you 59,000 other questions. We did not ask specifically if you were working or chose to reduce your workload because of COVID. The only question we had is, were you laid off? And at that point in the pandemic, the first 3 months, a very small percentage who answered this survey were laid off. The number of children, we had a sample of 122 kiddos who were under 5. This is grouped data that you're going to see with the kiddos who are 5 to 18. So as you can see in regard to the number of children, these families were representing about 600 children who had disabilities, and we defined it as receiving early intervention via an IFSP, preschool special ed, as having an IEP, or special education. So this is the sample we wanted. We wanted kids who were identified as in need of special education or early intervention because of a identified disability. So the kind of questions we asked, okay? And as I said, I'm gonna be not giving you all of the data, but we're gonna just talk about where they got their information. I gave you a little bit of background. People were very concerned about the politicizing of where information was coming from at that point, what their knowledge base was, the behaviors they were doing as a result of this COVID-19, formal and informal supports, their concerns, and their needs. Those are what we're going to spend some time. Their beliefs I didn't put up here because their beliefs were very mirrored their knowledge and then their anxiety. So if you think about way back when, beginning of the pandemic, there was not a whole lot of information. But again, this shows us this sample is skewed. The majority, 82%, were paying attention to the news. We did not dive down to what type of news and which news channels or papers or anything. Social media was next. And then it just goes down, family and friends, healthcare provider. The healthcare provider was lower than we're in the School of Medicine, than my colleagues here thought it would be or should be. Because we see our healthcare providers as being closer to any kind of medical need, such as a virus. So that was just one little flag that people were not necessarily trusting. We had another trust question, their healthcare providers to have the most up-to-date information, but instead they were going to the news media. That's only just for thought, for something that began knowing our highly skewed data set and knowing the number of the sample that we have, it may not mean anything, but it does show up here as lower than we would like. The next one is who do you trust to get information? Okay, and this was where we were looking at the science. So the Centers for Disease Control, again, this skewed population very much was looking at the science from CDC, Dr. Fauci, the State Department of Public Health, the local or county health, local school officials, and the governor. So it really does show that more than 50% were going to trustworthy sources at the time. We know that, you know, there are at least around 25%, a quarter of them that were not going to science, but it represents who answered this. We then asked, what do you know about this disease and or this virus that we have? And the 85% knew it began in China. I think that was pretty clear in terms of the Wuhan outbreak, that there was no cure for it, and that frequent washing of hands. And I think that you know, is still holds in terms of keeping ourselves, our hands clean. Mild, but look at this one. Most people who get COVID-19 will have mild flu-like symptoms. I think we are much more specific now about age group and risks in regard to who gets mild. And at the time, though, we were not partialing out by age and by the risk categories of different underlying diseases that we do know now are high risk. So most people were not really afraid of it if you think about that it's a mild flu-like symptoms. Pets can get and spread COVID. 27% thought that's true. 20% at the time, and I think it's more than that now, thinks it's a laboratory generated disease. And then it goes down to antibiotics, and then we're seeing people who may not have a good background in understanding viral or bacterial infections. Scientists are a month away, some thought that, and using home remedies. So what's interesting to me is that there were people who did believe these. Some of these that we know are we certainly know it wasn't a month away, and home remedies certainly, and pets can actually get and spread COVID. At the time, we did not know that. It's rare, but it has happened, but it's not anything that we're really needing to be as overly cautious about. We did not have anything in this about masking, because in the beginning of the COVID pandemic, when everybody was paying attention to it, we did not mask. So going back, that's something that would have been interesting to see. The next area was just what changes are you going to make as a result of this? And again, a high grouping. High grouping was going to wash their hands. They're going to stay home as much as possible. I think that was the message that we had from the government, and everybody who had a job was getting that message, and the schools were closed. So that's not surprising. Washing hands was definitely coming out, avoiding physical contact, avoiding sick people, not gathering more than 5 people. So that was down and out. Cough and sneeze into the crook of your elbow. So this went on. We had a whole bunch of things. The clean, frequently touched surfaces. I remember myself being a nutcase at just washing everything down, which is what we thought you had to do, including the groceries. We had groceries on here. Most people were saying they were disinfecting groceries. Wearing a mask was on this one in terms of were they going to do that? And wearing sanitary gloves when out of the home, and a full third was doing it. So at the beginning, this is a population sample that I think is fairly reflective of all of us. These are the kinds of things that we were doing. But then we got into support needs, okay? Formal and informal, and we defined those based on the disability sector, what we know families use. And so formal services was everything from special education and education to food, assistance with food, assistance with respite. And informal services were the kind of peer supports that we know are so utilized by families at times, and babysitting, a whole bunch of things just to get you through the day. And this is, we did a point in time from mid-March, what happened before mid-March till what happened now. And you can kind of see that most people were getting less formal supports because schools were closed for sure. But their informal supports were a little bit more than before, if you can see the very first bar graph, and not necessarily a whole lot less than before. So informal supports, you know, are here to stay, and families are very good, as we all are, at identifying our support networks. But you see the big dive that formal supports took. And we know that that's as important for many families, especially families with kids with significant needs. So the concerns we asked in terms of getting through the next couple of months, what were your main concern? Concern about the well-being of their families. And I think that that is extremely relevant because I think all of us kind of honed in to our immediate needs with our families. And then the next one, though, was that formal support of schools. And I don't think people anticipated that schools would be so far high up on the chain of worry, including above, but of course we know it's related, to mental health and physical health of families. And you can see that's more than 3/4. Delays in educational services, which goes hand in hand with changes. And then all the way down to no one taking care of the family, to loneliness, concern about safety, access to transportation wasn't that big, changes to education, loss of a job was less than we thought. But what was surprising to my colleagues who don't work with persons with disabilities or their families was the changes of education and special education going online. So that was concerns. But then when we translated into their needs that were not being met and they were afraid would not be met, education was first. Second was family support. Financial needs was down even under educational needs. And I'm not surprised by this, but I think this does show you that families, no surprise, of kids with disabilities, they know that their children who are on IEPs or IFSBs need education. We cannot have a gap for them. But this goes all the way down to even access to information. So the last slide I'm going to share is really the one that is not a surprise, but is blatant about what's going on. We asked families to rate their anxiety from the time of when the pandemic occurred. And as you can see, 76% who answered this question, we did not have everybody answer this question, very high to somewhat high. Everybody was living in a sense of real, just anxious about what was going to happen. And if you think back, what they were most anxious about is their needs or educational needs and their concerns, well-being, obviously, but then changes in education. So this really did narrow down to us the factors that families of kiddos with disabilities were having front and center. They had all the other issues we all were dealing with, including, you know, our physical needs, mental health needs, financial needs, but really education is very, very important to this group who participated in the survey. So I am going to end there, looking at both the time and the fact that I'd love to, I have not monitored the chat, love to hear some interpretations, because here's my question that I would like to answer or start a conversation. It's sort of, whenever I do a study, I always put front and center in my students the so what question. Okay, we gathered these data, so what? What are we going to do with it? And I think, to me, what this study did is put right in front of us the question of, how do we prepare better? Listening to this group of families who are highly educated, have jobs, have two-parent families, so we would consider them problem solvers in that they have the skills, not necessarily all of them, and yet they're saying their number one concern in a number of different questions that we asked was access and continuity of their children's special education and early intervention. I think that to me paints a picture to us of where we should be putting a lot of our energy, and yet we're still having struggles getting kids back to school as we speak right now, especially kids with disabilities, for good reasons. We have kids who are medically complex. We have schools that are not masking. We have public health, issues all around, and it's a political issue right now. I think we can all agree that it is less about following the science and more about personal freedom. So we've created a dilemma, and I would love to hear ideas or solutions or things you guys did. I know that the field, especially in early childhood, which most of you are in, came out in droves and did wonderful remote learning. But I think any parent, and I know there's probably parents here, of a kiddo with a disability will tell you remote learning is nowhere near the intensity of what a lot of our kiddos need, both in terms of behavior management, all the way down to instructional technology, all the way down to just explicit instruction. So parents know what their kids need. And as much as we try to stay in parents' lives by keeping relationships, keeping face-to-face, whether we're using computers or when I'm in a state that we did come back to school last September, all masked hybrid. So the kids came in 2 days a week, and then by January we were full day. But we're still going through those same concerns right now because our governor has said we're masked until the end of September. And yet we are now having political fights at school boards about this, and very rarely does a parent of a kiddo with disabilities speak up to talk about the real issues that they're dealing with and living with, because we still are, we don't have as much of a voice as parents who have typically developing kids, because a lot of parents of typically developing kids do not know what it's like to get through the day with a kiddo who is not communicating, who is acting out, who may even need technology to survive. It's a different headset. And I don't necessarily think, in my state, I will talk that we're meeting the needs of families of kids with disabilities now with all of this politicizing of do they wear a mask or not a mask. So open for questions, open for chat, open for anything. I'd love to stop talking and listening to you all and your experiences. And you can type something for sure.
And so if you want to unmute, to go ahead, you can do that. You can raise your hand. I'll call on you. Kurt and I are, I just had a floating head. Sorry, guys. Kurt and I are monitoring that chat. So go ahead and ask away. We're all stunned. I think it's really interesting here. I know now, Mary Beth, I've lost you on my.
I know, I've lost you too. Everybody keeps floating. I hate when we have these huge Zoom screens.
Right.
Yeah. Oh, there you are.
So Elaine, you have one. Go ahead.
Oh. So I was just going to say, when this first happened and we were told that we were going to be doing remote learning, as a clinician, I was like, what? How do I do this? I have no idea. And so this was a steep learning curve for me doing speech language pathology with early intervention families over Zoom. But over the course of the next couple of months, it of course got a lot easier, and parents became a lot more comfortable with it. And pretty soon it was just amazing how well sessions went. And I think that that's been such a great medium now, because if a family, if the mother is not feeling great, but the child is feeling well, that is an option that we can do for service, is that we can do remote learning and do therapy over Zoom. So I'm grateful for the skills that I have learned and that I've received because of this pandemic. And I hope that our state, the state of Utah is where I'm at, will be able to continue it on as an option for families, because I think that there's more than just a global pandemic that it could be very useful with. So
I definitely think that's a nice silver lining. We have another tool that we can use for sure.
Absolutely.
Okay, and then Pat, it looks like you have your hand up, and then I have a question also in the chat for you.
Yeah, so my name's Pat, and I see kids from both worlds coming out of the NICU and then coming into early intervention, and stay in touch with them long enough to see them going into special ed preschool. And my concern is these kids. And I don't think the medically fragile child has a voice, and we need to start listening to these families, because they're terrified that their child is going to be sick, and not just be sick, but die.
Right.
And I think we need to stop politicizing it. We need to stop, just look at the facts that these children need to be protected, especially now when it's become such an urgent matter.
Yeah. You know, I think both of you bring up two very good points, which is we need to individualize, right? I mean, that's the other thing that seems to have gone out the window. And I'm looking at the chat. I don't know who said that, Becky. I'm going to answer that too, about parents that should be concerned but are not anxious. You know, that's the science. But I think that we have a challenge. Our challenge is, how do we meet the needs of each family individually? So, you know, Elaine, when you said some of your families are doing great, they are, but I also know from families that having an option for one, just doing Zoom, I mean, think of us, we're a little tired of doing Zoom, that they really do want to get back in person, and they want their kids to be with other kids. But then, Pat, I'm totally with you in that there are kids. I have a kid who's medically fragile, and she's been going to school because I'm very comfortable with that. But there's something else that she's been invited to, and I don't think I'm going to let her. She's not even fragile anymore. She's 15, but she has congenital heart. And I'm making a decision, and I'm thinking any parent who has a kiddo who's itty bitty, or, you know, I agree. I think we have to be very cautious. And that's where I wish, not happening, at least here, that we could have stakeholders come up with, you know, use logic about what options we give. Because what happened in our state, because the Secretary of Education is our former commissioner, and he's a wonderful, great guy. But our state went with no more hybrids or remote available, you know, because I don't know why. But that's taking away an option for families, such as families of kids with medically complicated needs. And that puts families in another awkward situation. I think we have to listen to the fact that, at least in this study, families are very concerned about their kids' education. And we need to give them a voice and listen to the individual needs that they have. And hopefully they're using science, their medical providers are giving them the advice that they're using. As opposed to if they're using stuff that's not really, I'll give you the share of the non-logic that's happening here. My own little school board meeting the other day was hampered and taken over by anti-maskers. And the data that they were yelling, because they had 3 minutes, everybody had the microphone, were things like, my child who's wearing a mask is going to have brain damage. because they can't get enough oxygen through the mask. Another one said, my child deserves the right to get COVID to build his immune system up. You know, so that's fine, but I mean, it's not fine about the oxygen because there's definitely data that would not support that. But at what expense? That's what another mom came up and said, at what expense? So we have totally politicized this, and we've made it, unfortunately, real polarizing. And I think our population, who we are most concerned about, are the most vulnerable and may not also have the right information or being told they have to do things one way or not another way. How would you like to live in the state that shall be unnamed, that the school districts are now not getting money if they're asking kids to wear masks into school? I mean, that is, so we need to focus in on our population. And I think you guys know the folks, the parents you're interfacing with, but I think we also need to let them know that we know we're doing the best we can, but we need to hear from them how we can do better. And it's going to be as individual. You know, we've sort of lost that notion, but I think every family, there's an I in IEP and I in IFSP. It's really what we're built on, is individualizing.
Yeah, I completely agree with that. I love that input, individualized, and it's individualized for providers too, because we're all navigating all of that all of our families are. Awkward. I just want to say, I apologize, Becky. I didn't really answer your question because I don't have an answer. I just told you what we're dealing with here. I don't, but it is a concern. It is, for sure.
So, Janelle, just a quick, Mary Beth, thank you for that great presentation. It would be interesting to see, because you noted in your in the data that it was very skewed toward educated white folks, and that one of the primary concerns was the education of the kids. It would be interesting to see in a different ethnic, racial, socioeconomic group, would education still be that top priority, or are there other things such as, you know, being able to go grocery shopping, those kind of things, you know, that would be higher on the list? And, you know, unfortunately, we don't get to choose our data sets when we do these kind of self-selected type of research, but it's really interesting data to see that. And it would be interesting to see if there's anything out there that, that looks at specific socioeconomic, racial, ethnic demographics. But thank you for your presentation. It was wonderful.
Well, thank you. But I'm with you in terms of that. I think we can hypothesize that there would be different needs. But I don't have that data. I'm looking at some other family surveys that are coming out now, but they all tend to be people who can read, because you know the ways we do surveys online, because of COVID, we're not doing interviews, even though we could do them on Zoom. But it might be interesting to do some focus groups and to really get some parent voices who are different than what we have here in the other surveys.
We've all learned that awkward pause on Zoom too, right? So I'm going to do an awkward pause and see if anybody else has any other questions or input on that.
This is Summer again, and thank you, Mary Beth, for your presentation and for the survey.
Hi, Summer. Nice to see you.
It's nice to see the results that you were able to collect, and I'm hoping that there will be some follow-up too, to see as it progressed what the family dynamics looked like differently, and because I think at first, like, technology to those who are maybe educated and used it in their field was less of a stress. It became more of a stress, and then maybe it's more integrated and less of a stress again. But I really like the comment about how those numbers were couched, that they were families that maybe don't represent all of our population. And as I was thinking about that, I thought about those who I interact with. What can I do to make sure that I get all of the information to make informed decisions about the programming that we have? so that we are meeting all of the family's needs. And I think we can do a lot of that informally because we're not doing a study to be published. But I think that that's a good takeaway for me today, is to think like, what can I do to identify some of the individual needs, but also the patterns so that we can address those.
I think that's a great recommendation, that everybody who has families that they're serving should do check-ins fairly often, right? I mean, and not just, I mean, when we think about what's the lessons we've learned that we can do remote and that there are times when it's very appropriate. We've learned that families need to be checked in with. And I think just the check-in, you know, how is it going on? I think if we did another survey, and I'm not sure we are, but if we did, the questions we would ask is, it's, you know, we're all coming out a little bit of this. I think it would I'd want to ask families, what do you wish had happened? What are the things that you wish we could have continued on? Tell us how we would handle if, God forbid, we have something else, or God forbid this doesn't end for another. Somebody told me 5 years and I was like, I cannot even fathom. I'll be so old and tired of dealing with everything. You know, what families should be part of the solution, you know, not just service recipients. So I think the check-in is real important, but we should get some messages. And I think, as Kurt said, we are all real curious about the families we most worry about, you know, the ones who don't have their voices or have technology. So lots to do.
Yeah, lots, and great information. I also, I know we always worry about the families that we always tend to worry about, but those families that we don't think to worry about, I've been surprised on how impacted they were with COVID, at least on my caseload. I don't know if anyone else experienced that. And then it looks like, Gloria, you have a question.
Well, along the lines of checking in with parents, I think, especially at the beginning, but I still continue doing it. I did ask him, like after a couple of visits, virtual visits, do you feel like I'm giving you information that's helping? And I think that by itself, some parents were relieved that at least it felt to me like they were more apt to on the appointments and even have specific questions and things written down for the next appointment, because I was asking them that, you know, what is it helping? Did it help you? The information I'm giving you, is it working for you?
Yeah, that's good. Good.
Well, thank you again. That was just such useful information. And if you can stay on and hear our case presentation, we would love to have you do that. We are Gloria from DDI, and her big excitement, guys, is that she's actually petted a shark before. So that probably was pre-pandemic, right, Gloria?
Definitely pre-pandemic, yes.
So
I would love to stay on, but we are doing actually strategic planning with a team in Georgia that I stepped off of. I'll go back and see how they're doing, or see if I can get a text. If they're doing okay, I would love to stay on. But if you don't see me, I want to thank you for this opportunity. And all of us, good luck as we get through, as we navigate again, yet another year of uncertainty. And just mask up. That's my personal, based in science opinion.
Thank you. And her contact information will be on the slides on campus. So I'm sure she will answer any questions if you have.
Absolutely. And I may be back and forth if I can sneak in just to listen, because of course I want to hear the case. Thanks.
Perfect. Great. Okay. So I am going to go ahead, Gloria, and share your slides. And you tell me when you are ready. Can everybody see the slides?
Yes.
Okay.
Okay, so I work for DDI Vantage. I am a site facilitator for one of the sites, the West site more specifically, and I'm a child development specialist. I've been working there for over 18 years now. You can go to the next slide. So the main issue of concern was how to work with families during COVID virtually, and what was working and what's not working. Next, sorry. And so our goals were to help families help their children, and then make parents more accountable, successful in with the information we were giving them. And then the barriers that we were having were not having technology or not knowing how to use it from the family's perspective, and not actually being able to see a child sometimes in action was another barrier, that we could get the information from the parent, but it was hard to actually see the child. Next one. Things that kind of helped a little bit, I thought, was when our agency sent out a letter to the parents, letting them know how the visits look like, because at first, I think the providers as well as the parents felt like the kid had to be in front of the camera for the full session. And then that we as providers needed to get their attention for the full session hour. And once our agency sent out a letter to the parents telling them, we understand, you know, that many things can be going around the house, that things are happening, that you have children, that you may get this different things going on. We don't expect the child to be on the camera all the time. And just gave them a few ideas, things, and how those visits should look. I think it helped a lot, families and the providers as well. We also had the ability to try to use different apps that people wanted or were more familiar with. So lots of our families, we had Zoom, but lots of our families also preferred Snapchat. I mean, not Snapchat. What was the other one? WhatsApp. So we try to look for anything, any other way that the family would be comfortable with that. Another thing that we ask sometimes is ask families to record the child, and in a situation where maybe we couldn't get them to see them during our visit, but if they could record it and then share it with us. Then another thing that helped during this time was sometimes, again, they felt like they just had to be sitting there, and the child had to be sitting here, and it just had to be full on attention. And once we got into knowing a little bit about the family and how we were going to work, was to have the parent follow the child, doing whatever they're doing, playing, whatever it is they do normally. That was also very helpful. And then we were able to, we could still email handouts and notes. I had one or two families, in fact, that they didn't have access to that, but I could take a picture of the contact report or the notes or the handout and send it to them, and then they could open it up, and that they knew how to do, because maybe they didn't have access to a printer, or some of them had email, but they don't look at it that much. So I started mostly doing pictures, which is where I got to at the end. Next. We did, issues that we found was that we had some decline on referrals when it all started, meaning parents, I guess, figured out how we're going to do this. If the schools closed down, we won't be able to do early intervention either. And we did have a decrease of families seen, because some parents wanted to wait until we went back to face-to-face, because when we first started, nobody knew how long it was going to take. We figured maybe a month or two. So some parents just opted out. And then here's where I mentioned the letter that was sent out to families with visit expectations. That was helpful. We explained to parents that we're an educational model, that in fact it was important for them. I mean, that the education or the information that we gave them was the important part, not necessarily us being right in front of them all the time. And this is something that I know we say even when we're in the homes making the visits, that honestly, me being there 1 hour, 2 hours a month doesn't do anything if the parents don't follow through. Next one. Does anybody have any ideas or any things that helped during this time?
So, Gloria, that was useful information. I think all of us will have some great suggestions for that. So as we move into our breakouts based on what Gloria presented, a couple of things that we want to keep in mind is thinking about what challenges or what went well within the program, state, or area that we are in. If you had or your program provided resources to the family and staff during the pandemic. And based on what was shared during this session today, moving forward, what would you do? And what resources are you sharing with family and staff? All the facilitators, so the hub members, have those questions via email. That's what we'll be doing in discussion based on what Gloria shared. So I'm going to go ahead and put you all into breakout rooms.
And I'm going to say goodbye to everybody. Thank you for letting me listen to this, Gloria.
Thank you. Welcome back. Kirsten, I can see you talking, but you're on mute.
Yeah, I forget I go on mute when I change rooms, but thanks.
Well, I'm just like, you're sharing something really cool and I want to hear it, but you're on mute. So can you guys believe that it's been 18 months since we've been in this pandemic? I wanted to cry when Mary Beth just said 5 years. I don't want that. So while we're waiting for everybody to come back to have our discussion, I'm going to go ahead and launch a poll. If everybody would just take a minute and answer those questions, we would greatly appreciate it. Also, if you have any insights that you would like to share and put in the chat, please take a minute to do that as well.
Hey, Janelle, will you put in the chat again the email address for the ECHO? We just didn't quite get to all the questions, so I told some of them if we had the email address, we could have email and responses as well.
Yeah.
Thank you.
And Kurt, I don't know if you have access, but do not end the poll.
Yeah, that's what happened that one time. I went and it said end poll, and I'm like, I can't answer any of the questions. So I just hit end poll, but I am avoiding the red button today.
Okay.
Make an idiot response one time, that's my fault. After that, it really becomes a problem.
And so I can't see any of your faces because the poll is right in front of you guys. Does anybody have any great things that they wanted to share from their breakout rooms quickly? Kirsten, since you were the first one, how about from your breakout room?
Okay, that's me. I was in that breakout room. And I think that my favorite thing that came out of it was, despite the fact that there were challenges, it seemed to me we gave more positives than negatives about it. And the best thing, I think, was that it really got parents more involved. It was kind of the ultimate coaching model. And we talked about how it really helped bring them into it and get them working with their own child, and as early intervention really should be. And so that was the most positive thing for me. And I think the rest of the group shared similar sentiments about it.
Great, thanks, Lauren. Summer, how about from your group?
Okay, so some of the things that I like that were shared is how using videos or to model for parents made different kinds of connections than actually modeling with their child in person, and using a doll to demonstrate so the parent can do what you're doing was another way to make connections over virtual, as well as dropping off materials and then engaging in the home visit with when they have the things that are there. And then we talked a little bit about how difficult it's been to kind of tease out whether delays are because of a disability or a risk of a disability, or because they haven't had the same experiences. And that that's something that as people have been able to get back into person and have some hybrid that they can see the kids in person has been helpful. But we couldn't figure out a solution for it because that's a big problem for another day.
Right, that's a good thing. So Heather, were you in your own group?
Yep. So we talked again about the coaching as well, and how the focus changed a little bit. So prior to the pandemic, it was more of a provider-child with the parent-child interaction kind of being secondary. And then when we had to, move virtually, and the providers couldn't be there for any kind of hands-on intervention, that it really did become a coaching model, and the focus was on parent-child interaction. And we talked about how that focus will continue even as some programs move toward a hybrid model, and how that really shifted how they introduced the program to families in that initial visit. We also talked about some of the different strategies that were implemented to build capacity of families in between visits. There was a lot more YouTube videos, resources, articles, checking in between visits with families. So families really were given heightened support in between visits, and we know that's where the magic happens, to really work with their child. And so those were our big takeaways there.
Great. Barb, has your group shared?
No, but actually Kurt was the note taker and ran it, so I'd probably want him to share.
Okay, Kurt.
Yeah, a lot of the same stuff that we were talking about. A couple of things were kind of unique that came out of it. One of the programs would actually, with weighted blankets and some of the kind of the AT stuff or toy stuff that was less expensive, but they would work with the families, figure out what needed to be in the homes. And then with some grant money that they had, they would actually purchase some of the, a weighted blanket or a sensory stack or something like that for that family to keep them there. Another thing that was really interesting was utilizing music to help them kind of get away from the screens all day and be able to either do gross motor stuff or language stuff using different YouTube music videos or songs or that kind of stuff. So they could work on body parts, they could work on, whatever it was that their needs were. And I think it was Carolyn, I think was her name, that had come up with that. I thought it was a really interesting idea, using music to be able to help with the other areas of development.
Oh, great. Kate, your group?
Yeah, so we had a couple of people from DDI that were in our group. So they shared that letter that was sent out because we were kind of curious to know what it included and how helpful it was to kind of set the expectations of, like, for the parents of what they are wanting. And then I also liked it had reminders of, like, keep your device charged, stay near your Wi-Fi hub, just so some of those technical things that sometimes parents don't realize that kind of help facilitate the session as well. So that was really helpful to kind of just go over that together. We also had someone from Idaho that kind of talked about how they're doing more in-person visits right now. So we had a conversation about, like, what is it going to look like moving forward, and how we can, take all the great things from the virtual world, but then also the great things from having, in-person visits. And she kind of shared their gradual process that they took towards moving in person. But then we ended up having a conversation about what Mary Beth Bruder talked about, like that individualized plan, and how we really need to meet the family's needs individually.
Yeah, great. Gloria, would you be willing to share your letter so I could post it on Canvas for all participants? You're on mute, Gloria, if you're talking.
Megan, I assume we can share that?
Yeah, is that one I wrote?
I'll bring it back.
It's all good. If we send it to all the families in our program, y'all can have it and do what you want with it. Sure.
Yeah, this sounds
I'll send it to you.
No, that's fine. Yeah, send it to Janelle and or however.
I think you guys shared it with the consortium, Megan, because I have it.
Oh, great. See, you guys, it's all a blur.
Everything blends in.
Yep. It's been a long time.
Right. If you're willing to share it, I'll share it on our campus so all participants can see that. So we are at time. Those resources will be on the Canvas site, as well as the recording and the PowerPoints. Our next month's session is October. I can't believe I almost just died saying that a little bit. October. Ann Larson is going to be talking to us about family coaching. She's from the University of Michigan. Her and some colleagues are talking about it. And so register for that. You will get that survey by the end of the week, so please fill that out. And thank you for your time and participation in our ECHO session today.
Thank you very much.
Thanks.